Welcome to Physiomedics. In this video tutorial, we are going to discuss gout. What is gout? Gout is a disorder that causes sudden attacks of intense pain, swelling, and redness in your joints or soft tissues. In many cases, the first attack occurs in the joints of the big toe, but gout can affect many other joints. Gout is a form of arthritis caused by too much uric acid buildup in your body. Gout often causes sudden pain and swelling in one joint, often the big toe or other joints in the feet. Uric acid is a natural substance that's in your blood. Your kidneys filter uric acid, but if levels get too high or the kidneys can't remove enough of it, urate crystals can form and settle into a joint, causing pain, swelling, and redness. Gout affects men more often than women. Foods rich in purines, high alcohol intake, and drugs like immunosuppressants and diuretics can raise your risk of gout. What are gout symptoms? Gout attacks are very painful and can happen suddenly, often overnight. During a gout attack, symptoms in your affected joints may include intense pain, discoloration or redness, stiffness, swelling, tenderness even to a light touch, warmth, or a feeling like the joint is on fire. What causes gout? A buildup or a buildup of excess uric acid in your body causes gout. Your body naturally makes uric acid when it breaks down chemicals called purines found in certain foods and drinks. Your kidneys usually filter uric acid out of your blood and then it leaves your body when you pee. Sometimes your body makes too much uric acid, or your kidneys don't remove it from your blood fast enough. When your body has high levels of uric acid, hyperuricemia, uric acid crystals can build up and settle in your joints. The sharp crystals clump together and causes sudden episodes of pain, swelling, and other symptoms. Having temporarily high risk high uric acid levels doesn't mean you will definitely develop gout. Many people with hyperuricemia never get gout. What test will be done to diagnose gout? Your healthcare provider might use a few imaging tests to take pictures of your affected joints. These tests can also show if gout has caused any changes in your joints. You might need X-rays, ultrasound, magnetic resonance imaging (MRI), a CT scan, specifically a dual energy CT scan. Other common tests to diagnose gout include blood tests to measure the uric acid in your blood, joint aspiration using a needle to remove a sample of fluid from inside a joint. How is gout treated? Treating gout is usually a combination of managing your symptoms during a flare and reducing how often you consume high purine foods and drinks. Gout medication include your healthcare provider might suggest medication to help manage your symptoms including NSAIDs. Over-the-counter NSAIDs like ibuprofen and naproxen can reduce pain and swelling during a gout attack. Some people with kidney disease, stomach ulcers, and other health problems shouldn't take NSAIDs. Talk to your provider before taking NSAIDs. Colchicine. Colchicine is a prescription medication that can reduce inflammation and pain if you take it within 24 hours of a gout attack. Corticosteroids. Corticosteroids are a prescription medication that reduce inflammation. Your provider might prescribe oral pills. They may also inject corticosteroids into your affected joints or into a muscle near your joint intramuscularly.